Hi, I'm Heather Garza, Midland Quality Alliance Care Manager for Midland Health. Midland Quality Alliance is a physician-led medical care network, and our goal is to provide high-quality, cost-effective care to our members, and with a focus on good communication between our provider and our patient. As the Midland Quality Alliance Care Manager, I work with the moderate to high risk population with Midland Health Covered Lives, and I help them to get and stay connected with their healthcare providers. I help them to understand their medications, their medical conditions, as well as the treatment plan that has been prescribed. We also create and work on healthcare goals that they may have and want to achieve, and then also I help them connect with community resources that they may be needing. When I identify a covered life that may be at risk, I usually send out a welcome letter to explain care management to them. Then I make a phone call to them, explain again what the care management program is, and then also offer for them to complete an assessment. From the assessment, we then determine needs that they may have, and then we look at what healthcare goals they may want to achieve, and then we set up a schedule as far as how often we will contact one another, and just based off of the needs that we've determined. I have several patients that we have some success stories, but one that comes to mind the most was a patient that came to the emergency room, was diagnosed with a life-altering diagnosis, and I do follow-up calls from the emergency room, and so I was the first contact that she had after her diagnosis, and she did not have a primary care provider. I listened to her needs and found her a primary care provider that I thought fit best with her needs. From there, she moved on to her primary care. She has adopted the whole food plant-based diet. She has lost 35 pounds now, and now we're trying to eliminate her medications as well, and she's doing wonderfully. Her thing is, she says that she now loves herself again, and she has energy to do things that she didn't realize she didn't have. Another patient that I have, I worked with that needed assistance with a very costly medication. I was able to help her fill out the paperwork, go through the channels to get that submitted, and within a week we had a 12-month prescription that is delivered to her door monthly for free. To have an impact on my covered lives gives me great satisfaction. I like to be their cheerleader. I like to give them motivation to stay on track with their goals. I have been called a motivator. I have also been called a lifesaver for them, and that gives me great satisfaction at the end of the day. I like to also keep that in line with Midland Health's vision for making Midland the healthiest community in Texas.